So what Raw was supposed to say when he stood up was that we launched CoHealth 2.0 across the country and healthcare providers across Canada, and we're really excited about that. We're providing a really unprecedented patient and care provider experience starting today. So, my presentation's called Come Together Right Now Over Healthcare. And we live in a system today, in a landscape that many of you wouldn't be surprised by, is incredibly ripe for opportunities to be improved. Across the board, emergency department visits are increasing at a rate that is not commensurate with population growth. Care providers are doubling up on time spent on caring for patients across the care continuum. And in addition to that, many patients are waiting in hospital beds for days just so they can be transported to a different care continuum and supported. So why is this happening? Well, I've worked in the healthcare system for a number of years now, and what I've found is that there are blocks or walls between the key components of the system. Hospitals, primary care, allied healthcare professionals, community care, everybody's operating within their own silos. And what does that mean? IT doesn't talk to each other. There's no interoperability of data. We've built a system that fundamentally cannot scale. That's the problem. And when we look at the landscape in terms of what's actually happening when there's a need in the market, because there are significant gaps, industry rushes in to fill that void. And here, you can see a snapshot of some of the startups making meaningful change to try and plug the holes in a system that fundamentally isn't built to scale. They're focusing on things like care coordination, communication between care providers, healthcare as a service, patient experience, and patient engagement. But fundamentally, what I think we're doing here is building our own islands of usefulness, not bridges between them. And I think we've taken a page out of the healthcare system in the way that we've adopted our approach. We basically flipped to the page on isolationism and said, yeah, let's do that, when the system itself is doing it today. We can be doing better, and we should be doing better, because as innovators, as startups, as digital health companies, we're supposed to be working together and collaborating. And we should be setting an example for the way that the system should be structured. So what is the future of healthcare built on? Well, Daniel Warner was up here on stage touching upon this a few moments ago. It's built on collaboration, it's built on consolidation, and it's built on cooperation. This is going to be happening whether we like it or not, because that's what the system needs. You don't need 100 different healthcare apps out there for care providers and patients. You're just adding noise. You're throwing technology at problems and processes that don't scale in the hopes that something's going to stick. You need a single point of access to manage the entire healthcare experience. And fundamentally, you need to connect the dots in healthcare. 18 countries in the EU this year have signed an agreement that by 2021, they are going to have complete interoperability of data, and they're going to exchange patient summaries and e-prescription data across borders. 18 countries. You think we could do that today across 18 hospitals in the GTA? There's no chance. This is happening at a scale that we've never seen before, and it's coming, and it's going to hit us in the face because collaboration and consolidation are required. So fundamentally, I know that there are some Beatle fans in the audience. Come together over healthcare right now. That was for you. But fundamentally, this is a call to action. It's not about building islands of usefulness and hoping that something is going to stick. It's about coming together to work on win-win opportunities for the digital health companies here so that we can build solutions that add value for patients and care providers across the board in a consolidated system that requires collaboration and cooperation. So when you're here today, and hopefully when you leave, engage with your neighbor. Understand how you can work together. We're today working with some of the companies on the slide that I showed you previously because we believe in a better vision for our healthcare system. So if you're interested in connecting the dots with us, we'd love to chat. This is my email. I'm pretty friendly. Thank you so much.